Okay, let's talk about C-spine for positioning this week. The C-spine, I told you there were a couple landmarks that you need to be familiar with. The EAM, which is your external auditory meatus, which is located right here on your ear. Right below that's going to be C1, C3. That Adam's apple that you can see protruding on some folks is actually going to fall around C4 to C5. And then when you can feel that vertebral prominence sticking out of the back of the neck, that's approximately where C7, T1 will fall. The big thing for doing C-spines, make sure that all jewelry is removed. Make sure if they have any dentures, they remove those. So anything that bobby pins, hair ties, those types of things, you need to have them take out. When you go to stand them up against the table, our bucky, we want to do our lateral positions if we can standing up. This allows those shoulders to relax. Your central ray will be directed along the mid-coronal plane in C4, C5, which is where that Adam's apple fell. So a lot of times if you find your EAM, you can center the top of the cassette at the EAM, and then that will naturally put that central ray at about C4, which will include down to C7. So patient stand against the bucky, arms relaxed to the side. You will have OID from here to the bucky, and that's okay. And that's because there's nothing you can do with the shoulders. You're going to have OID. We compensate for this by bringing our sit out to 72 inches. So you're going to relax, drop those shoulders, see the top of the light field up here by the EAM, center on C4, mid-coronal plane, 10 by 12 unless you're using a DR plate, which is your 14 by 17, and collimate down to a 10 by 12. Again, you want to leave it open lengthwise to 12. You can collimate side to side down to about an 8-inch instead of the 10-inch. Your film is going to look something like this. Here you can see all the way C1 down to C7. You'll have a portion of the mandible. C1 and C2 are overimposed, so they're superimposed because that's where your axis and atlas are. There should be no rotation, so you should be able to nicely see through the cartilage between the bodies, so the spacing. If your patient comes in and they are a trauma patient, you will not do the standing. You will actually do them on the backboard or on the stretcher. You can pull them over onto the table if they're on the backboard. You will take the lateral C-spine first, and then you need to get clearance from there as to what to do. So if they come in with the C-collar on, you need to have permission before you can remove that. The next one, AP open mouth. We're going to bring our SID to a 40-inch. Your patient's upper incisors and the base of the skull will be superimposed. They need to open their mouth as wide as you can. Use a 10 by 12 collimate down to about 4 by 4. So your central ray is going to enter right into the mouth. So they need to open their mouth nice and wide. Keep the teeth and the base of the skull so that they're aligned. And you're going to center directly in the middle of their mouth, which is going to put that right on C1, C2. So you can do this with them laying down or with them standing up. This is called the open mouth view, which is also called your dens or odontoid. And it's going to look something like this. So your atlas and axis are going to be seen in their entirety. Those open incisors, you see the teeth right through here, superimposed over the back of the skull. No rotation. For your C-spine, you're going to use anywhere between 75 to 80 kVp. Usually about 15 mass, around that range, so between 10 and 20 for your mass. Your AP axial, you're going to have your patient close their mouth. You're going to angle 15 to 20 degrees cephalic. You're going to still keep your central ray at C4. You're using a 10 by 12 cassette, keeping that SID at 40 inches. You're going to best demonstrate C3 through T2. There should be no rotation, so you should be able to see those transverse processes on both sides. Your base will be superimposed with the mandible. We do both obliques. Depending on where you work, you will either do the PA or the AP. These can vary between 72 inches and 40 inches depending on where you work. And so I've seen that it's a great variation, so every hospital does this one a little differently. So the AP's for sure at 40 and your open mouth, 72 inches for sure for your laterals. We're going to keep it at 40 for your obliques, and we're going to put a 15-degree angle. You're going to angle that cephalic. We're going to do the RPO and LPO for lab. Just be aware that you could be at a facility that do RAO or LAOs. Changing your position doesn't change. You still have a 15-degree angle. You're going to keep it right on C4. Top of that image receptor follows across the EAM all the way down to T1. This is what this will look like. Look how nicely it opens up those pedicles and that intervertebral foramina. So you can see right through there. The base of your skull is not superimposed. You will get all the way down to C7. If you do have a trauma patient, you won't do the obliques. You will just do the lateral position for trauma. And so your C color will look like this. You're still directing your ray cross table into your grid cap with your cassette. This is one where Cindy talked about the air gap technique. You can use that if you don't have a grid cap. You're going to center C4, top of the film at EAM, down to C7, and don't worry again about the OID that you're going to have between the image receptor. So your film, actually let's go back to this, your film is going to look like this. If you cannot get C7, you're going to have to do what's called a swimmer's view. So a swimmer's view looks like this. Your arm's going to be down by the side. The arm that's closest to the image receptor you're going to raise above their head so it looks like they're doing the side stroke. You're going to come through at C4. So you're in a true lateral position. Use a 10 by 12 or a 14 by 17 depending on if you have the DR plates. You're actually centering through T1, so 1 inch above the jugular notch. So you'll have C4 will be up here. Your T1's going to fall right about through here. So your central ray is coming down a little lower than it was for those other ones. So here's a true lateral position, what it's going to look like for your swimmer's view. And you should get something that looks like this that's going to demonstrate that C7 T1 that you couldn't see on the other film. And here's another one that doesn't look as nice because of the scatter, but you can still see those vertebrae. Your book goes into a lot of special projection, flexion, hyperextension laterals. I did a lot of those at an orthopedic office. So basically you center like you do for a typical lateral, and then you're going to have them flex and extend their head. The Fuchs method and the Judd's method we'll go over in class, along with the wagging jaw and those AP axial pillars. So we'll talk about those in class, but just kind of look them over in your book so that you're familiar with what I'm talking about in class. That Fuchs method is great if you can't get the dens with them for an open mouth, so you'll have to do this. So if they're in a trauma situation, they're unconscious, you're not going to be able to open their mouth, and so that Fuchs method is really nice to do in order to see that. And sometimes we'll do a Judd's method, which is the opposite direction, and it does the same thing. It's going to help show those mastoid tips, and so you can see through that odontoid. So here again is a picture of them shooting for that Fuchs method, which is an alternate view to get the odontoid. So you can see right here's that dens, and that's what that's going to look like. Just like that. Again, here's your dens, and that's what we're looking for. Wagging jaws, they're just going to move their jaw while you're taking the exposure. So it'll look something like this to blur out the mandible. And here's for those pillars. So we'll talk a little bit about more of those in class, and I'll focus more on what you need to know for evals this week.